Roughly 200,000 Texans are expected to receive coronavirus vaccines this week. A lot of questions remain if a pregnant woman should get the vaccine. Hill Country reporter Leah Durain is live in New Braunfels and shares what local medical experts are saying. Leah?
Well, there's a lot of information out there about the coronavirus vaccine, and here in Comal County, medical experts took some time to address some of those common questions. They did so in an online session this week. You can actually watch the full hour-long discussion on the City of New Braunfels Facebook page if you really want to dig in and learn a lot this week. One of the topics that came up in that video is, what if pregnant women, what about them? Should they plan to get the coronavirus vaccine? Local doctor Emily Briggs explained the vaccine cannot change DNA, nor can it cause any genetic changes. She encourages women to think about the potential health impact, especially if they were to pick up the virus here in the community.
Any woman who is pregnant and considering having this vaccine, you must consider the community transmission level. You have to consider the risk of contracting COVID yourself without the vaccine. You also have to consider the risk of fetal complications if mom gets infected. So all of these things, it's not just should I get the vaccine or not because of the vaccine itself, but all of these other considerations must be made.
Dr. Briggs also said that so far the science does not point to any infertility arising due to the vaccine. In fact, several women who were part of those initial vaccine studies and trials ended up getting pregnant afterward. So doctors will monitor them, make sure that they continue to have a healthy pregnancy through the full term. But again, the science does not point to any fertility issues. Reporting live in New Braunfels, Leah Durain, the KEN 5 Hill Country reporter.
Thank you, Leah.